Hi, my name is Ben Avey with WellSpace Health, and today I'm going to share a little bit about WellSpace Health's Crisis Receiving for Behavioral Health, or CRIB. CRIB is a 24/7 program that we've designed for people who are in a behavioral health crisis and a time for them to recuperate from their behavioral health crisis without going to the hospital or to jail. Now, CRIB is actually part of WellSpace's crisis continuum that can often start with the 988 suicide and mental health crisis line. If you're unaware, 988 is a national hotline that anybody can call if they are in a suicide or mental health crisis for immediate care and services. Here in Sacramento, WellSpace Health answers the 988 hotline and has a connection directly to CRIB. For some folks, if you're in a behavioral health crisis, 988 or community partners may want to refer you to CRIB, which is where we're today. Crisis Receiving for Behavioral Health was designed as a 24/7 program for a person who is in a behavioral health crisis. We don't like to define what that behavioral health crisis is because we know it's different for everybody. But for many people, they're intoxicated on a substance, or they're just in a mental health crisis and they need a safe place to go and recuperate from that crisis. When they arrive, we're going to have a very simple process with our front desk where you're going to share any information that you have about that person. One of the most important factors is, where did they come from? Where do they live? Because we want to make sure if we can't refer them into another program or resource, at a minimum, we're going to take them back to where they live so that they are not abandoned in a part of the community they don't understand. Now, we're also going to ask our patient to come over into our nursing area, and they're going to take some vital signs. We recognize that people who may be in a crisis may not have the same heart rate as me, but we also need to make sure that they're appropriate for the care that they receive here. After you check in with our front desk staff and share any information that you may have about the client, we're going to move on to the next step of referring somebody into their program, which is securing all of their personal belongings. We understand that when somebody comes to CRIB, if they're worried that they're going to lose their stuff, they may not volunteer. So we make sure that their personal belongings are safe and secure while they're here at CRIB. In our lobby, we will roll one of our black boxes out for the patient. They'll put their personal belongings in the box, we'll lock it with a padlock, and once we do that, we'll know that their stuff is safe and we're safe. We don't need to know what's in the box because we know they don't have access to it and nothing in here can hurt us. Once a client comes into the back of our center and you've gone about your way, we are going to assign each client to a room. In that room, we have pods that are on the ground where somebody can lay down and be safe and rest, or we have chairs where they can sit up if they're just not ready to lay down. We're also going to be providing them with 24/7 care. Within our center, we have a team of nurses, substance use counselors, case managers, and other folks whose primary goal is to help them resolve the immediate crisis that they are in, while also working to avoid a crisis in the future. Key to our model is at the end of their stay, we want to make sure that we give them a ride home. We want to take them back to the community that they're from so they don't feel abandoned downtown. And we'll actually exit right here where we have a WellSpace Health van to make sure that they get back to their community and they understand how to come back here if they are in crisis again. And that's it. That's CRIB. It's a moment in time, a moment in their life where we want to make an impact, and hopefully we will have an impact. But it all starts with you, our referral partners, making sure that you're making those solid connections to us and building that relationship so that we can work with people who are in a behavioral health crisis in a productive way. Thank you for being our partner. Thank you for working with WellSpace Health, and thank you for taking a moment to learn a little bit more about CRIB.